I had muscle pain mainly in my shoulders because I wasn't using the lumbar support and I really felt tension in my upper back. Also, when it comes to dentistry ergonomics, there was always one arm, our main arm, that's working, but the opposite arm is subject to static tension, and it can also be problematic in the long run to always be making static reaction and contraction movements, and with the other arm making lifting movements. So I felt it in two areas of my body and in the lumbar area. The advantage is that the way I get into position, I can be very close to the patient, and since the dental chair is raised, I can get all the way underneath with my chair and still be in a vertical position, keeping my posture well aligned. And most of all, the big difference is that when I'm like that, there's no tension in my lower back and no tension in my shoulders either. This allows me to always keep my upper body in alignment when I move. The only thing that moves is my legs, which move the chair, so I can really get up to the dental chair and be very close to the patient. And throughout all this, I feel no tension in my lower back or in my shoulders. It definitely helps me maintain perfectly straight posture that will allow me to move my body as a single unit and then, when I'm in position, use it without causing any strain. In fact, the only movement I make is a waltz-like movement, as I mentioned. This allows me to be really relaxed and to make very fluid movements, keeping my body harmoniously positioned. I can get close and this arm is always relaxed. When I started working, as soon as I lifted my arms, the way I did with my old technique, I felt it right away. I said, okay, it's true. And I changed my position and I felt the difference right away. We get very accustomed to having that feeling of our muscles being relaxed. Being able to really fit under the chair allows me to be close to the patient and therefore keep my posture better aligned. I don't have to bend my head and block the assistant's view. It allows me to really get my legs under the chair completely, and in addition to being higher, to really be able to see inside the patient's mouth without having to make uncomfortable movements too. So being close and having easy access to the patient as well as the ergonomic aspect for four legs in close proximity. Once the chair is placed the way you need it, it's always easy to get back into that position and feel comfortable. It's just a matter of adjusting it initially. Then afterwards, you can find that comfortable position, and it's not hard to adjust. For sure, the first words that spring to mind when I think of my chair are comfort, and most importantly, lack of pain. When you're not in pain, you're more comfortable at work. I think it's an essential tool for our daily work. I got it because I needed to relieve strain, but this tool should be available right from the start as part of the process of achieving comfort and improving our practice. We should have it for preventative purposes to be able to say, let's adopt the right posture to prevent chronic pain, which is often related to the ergonomics of dental work.